Good afternoon. My name is Claudia Nunez. I'll be your nurse for the day. I'm going to be performing something called a head-to-toe assessment. That's something that we nurses do to gather a little bit more information about your overall health. Okay, so give me just a few seconds. I'm gonna go ahead and wash my hands first. Okay, so like I mentioned, I'm going to be your nurse for the day. I'm going to be taking care of you. Anything that you need, please let me know. Like I mentioned, my name is Claudia Nunez, okay? So I wanted to ask you, what is your full name?
My name is Jorge Landa.
Okay, perfect. What is your date of birth?
I was born in October 1st, 2001.
Okay, and how would you like to be addressed today?
Jorge is fine.
Okay, no problem. And Jorge, are you having any type of pain today?
I am. I do have a headache.
Okay, and from 1 to 10, how much is the pain that you're feeling?
A 2.
Okay, and can you describe a little bit how is the pain? Is it a throbbing pain, a sharp pain, or it's just like an ache?
An ache.
A head. Okay, perfect. No problem with that. Is there anything that makes your pain feel better?
I did take Tylenol before coming.
And that's helping your pain?
Yes.
Okay, no problem with that. Is there anything that is making your pain feel worse?
Maybe when I'm having a headache, if I get up and I'm too active, it does get worse. Also, when I feel stress, it does tend to get worse with stress.
Okay, yeah, no problem with that. Okay, I do understand that. I'm sorry about that. So if you said that the Tylenol is making you feel better, we will prescribe more once you get out, or I will let the doctor know, okay? And I would like to ask you, are you able to take care of yourself?
Yes, I am.
So you're able to perform your daily activities like brushing your teeth, going to the bathroom by yourself?
Yes, I am.
Okay, no problem with that. Okay, perfect. Do you have any questions at the moment?
No.
You do not have any questions. And where are you from?
I am from Miami.
You're from Miami. And
Yes.
where are your parents from?
They're from Cuba.
They're from Cuba. Okay, no problem. And why are you coming here today?
I'm here for my general checkup.
You're here for your general checkup. Okay, perfect. And besides the Tylenol, are you taking any other specific medications?
No, not at the moment.
Not at the moment. Okay, perfect. Have you had any surgeries in the past?
No.
No. And my last question, are you allergic to something?
No.
You're not allergic. Okay, perfect. So right now we're gonna do take some of your vital signs. The first thing that I'm going to take will be your blood pressure. So if you can raise your right hand, I'm going to place the cup 2 millimeters above your brachial artery. Okay, and your brachial artery will be here, and then 2 millimeters will be in this part. Okay, perfect. Okay, so I'm going to inflate until I do not feel your pulse anymore. Okay, and your radial pulse will be here. So I'm going to start inflating now. Okay, perfect. And that will be around 120 when I don't feel it anymore. So I'm going to deflate And with my stethoscope, I'm going to inflate to 150, 30 millimeters above. Okay, perfect. Your overall blood pressure will be 139 with 80. That will be normal for your age. It's within normal limits, okay? So following that, I'm gonna be taking your pulse. I could have your arm. Okay, perfect. So your pulse will be 85 and your respirations will be 18 at the moment. Okay, I'm gonna take your pulse oximeter. Put your hand down. That'll be perfect. Okay, and that will be 98%. Above 95, it would be the regular saturation that your body will have, okay? So this is within normal limits. So your pulse oximeter tells us how much oxygen you have in your blood. So now I'm going to take your temperature. If you could open your mouth and raise your tongue, okay? Close your mouth and do not bite down. Let's give it a few minutes. So your temperature is 97.5. That's within normal limits. I'm going to discard this. Okay. Perfect. So I'm going to start the head to toe assessment. I'm going to start with your head. I'm going to check your hair. There is no visible patches or any alopecia found. I also see that it's clean. You have maintained a good hygiene. There is also not visible odor. I do see that your head is very symmetrical, and yeah, there is no odors that I could see. I'm going to now inspect your mouth. If you could open your mouth for me. Say okay, I do see that you have 2 missing teeth. Your tongue is pink at the moment. I also see that your gums are clean. Okay, there is no visible lesions on your mouth at the moment. I'm going to now check your ears. Okay. Okay, so there is no drainage in your ears. They appear to be clean at the moment. There is no inflammation. Does it hurt when I touch it? There is no tenderness also found in your ears. No redness that I could sense. And there is also not a very excessive amount of serum. Now I'm going to inspect your eyes. I'm going to put this light very subtle just to see the reaction of your pupils. Okay, so I see that it's a 3 millimeters, and there is a contraction or a reaction upon light on this side too. I see that your eyes are symmetrical, your pupils are round. Okay, so if you could follow my finger without moving your head. Okay, perfect. No problem with that. Do you have any problems with your vision? Okay, if you could read, what does it say here?
Bloodborne precaution.
Okay, perfect. Thank you so much. Okay, so we're gonna go now to the next step, that it will be your neck. I'm going to palpate your trachea at the moment, okay? If you could swallow for me. Okay, perfect, perfect. I'm going to now palpate your lymph nodes. Okay, perfect. No problem with that. Your lymph nodes are within normal limits. I did not sense any type of mass upon palpation. I'm going to now check on your chest, and if you could stand straight for me. Okay, so your chest seems symmetrical. At the moment, it appears that it's very symmetrical. The respirations appear that there is no labor upon respirations, and your respirations were assessed at the beginning, and they were within normal limits. I also am going to palpate your chest. Okay, perfect. I see no thoracic distension. You can take a seat at this moment. I am gonna go ahead and auscultate your lungs too. Okay? So when this touches you, when the stethoscope touches you, I would like for you to take a deep breath, okay? Okay, I'm gonna do the same thing to your back. Take a deep breath. Okay, perfect. No problem with that. I'm going to inspect your breasts. Okay, they appear symmetric one with the other. Have you had any sensation, any mass, any pain or discomfort in your breast?
No.
No? Okay, perfect. No problem with that. So I'm going to assess your spine at the moment. Okay, so your spine appears erect without any curves. I don't see any curves at the moment. I'm going to palpate your spine to see if there is any mass, okay? If you could bend over for me. Do you feel any pain when you bend over?
No.
Okay, perfect. Can you stretch your arms? What about your legs? Okay, perfect. No problem with that. Did you feel any pain with that?
No.
Okay, so upon palpation, I felt no mass. I see that your spine is erect without any curves, any visible curves. There was no pain upon leaning forward, right?
No.
Okay, perfect. So now I'm going to ask you to rotate your spine. If you could do that for me, like this. To the other side. Was there any pain?
No.
Okay, perfect. No problem with that. So I'm going to assess now the cardiovascular part of this assessment. I'm going to palpate your pulses. Okay, so I do feel the radial pulse. I will say a 2 plus. Okay, your brachial pulse is also 2 plus. And then now I'm going to check the capillary refill of your nails, okay? Okay, perfect. So they're refilling within 2 seconds, okay? So that's within normal limits. I'm going to assess also your upper extremities, and I see that there is no visible edema. I'm also going to check on the bottom. Let me see. Upon palpation, do you have any pain? Okay, I also do not see any visible edema. I see that your hairs are intact. There are no patches at the moment, and that's perfect. Your skin is warm to touch, and you also conserve a good hygiene. So I'm going to auscultate. So I would say that there is no presence of edema in either of your extremities. There is also no bruises or ecchymosis that I could see on your skin. So I'm going to auscultate your heart, okay? And this time you can breathe normal. Okay, perfect. So I do see that your heart has a regular rhythm. I did not hear any murmurs or anything unusual with your heart rhythm. I would say that it's very regular. Okay. Also, I am going to auscultate your carotid. Okay, perfect. And I'm going to check for any. There is no jugular distensions, and your carotid felt within normal limits when it came to the auscultation. Okay, so now I'm going to assess. I'm going to assess your musculoskeletal system, and I would like for you to raise your arm. Okay, I would like for you to raise. You can put your arms down. You can put your legs back in. Okay, do you have any pain on your joints?
No.
Okay, do you have any pain on your muscles? Okay, perfect. So I do see that your muscles seem very symmetric. Okay, there is no pain in your joints, in your muscles, in any tendons. Do you usually work out?
Yes.
Okay, perfect. That's great. Now I'm going to assess your abdomen. So if you could stand up for me. Okay, perfect. You could go a little bit back. Perfect. So I'm going to inspect your abdomen. Okay, so I do not see any distension. I do see that the abdomen is very symmetrical. I'm going to now auscultate your abdomen. Okay, I do not hear any hyperactivity, but I do hear regular bowel sounds, movements. Upon percussion, there is some dullness that I notice, and then let me palpate. Did you feel any pain while I was palpating?
No.
Okay, upon light palpation, I felt no mass, neither with the palpation. You can put your shirt down. And I'm going to now assess your neurological part of the assessment. I'm going to assess your level of consciousness. Okay, so can you tell me your name one more time?
My name is George.
So your name is George, okay. Do you know where we are?
I'm at the clinic.
You're at a clinic, okay, perfect. Do you know what we're doing at the moment?
We are doing a head to toe assessment.
Okay, that's great, that's perfect. Do you know what year this is?
We're in the year 2024.
Okay, perfect. So George, it's alert, aware, and oriented times 4. In this moment, can you raise your right hand for me? He obeys commands. That's okay, you can put it down. The patient's speech is very clear at the moment. I'm going to assess some of your cranial nerves. If you could smile for me, you could make a sad face. Okay, perfect, that was great. I'm going to see, can you feel that?
Yes.
Okay, perfect, no problem with that. So the patient does respond to light touch. I'm going to also assess another cranial nerve. Can you raise your eyebrows for me? Okay, perfect, that's amazing. So now I'm going to assess something that is called a gag reflex. Okay, so I'm going to give you some water so you can drink. Okay, there you go. Okay, perfect. So gag reflex, it's perfectly. Okay, have you felt any sharp or dull sensations? No sharp. Okay, perfect. Can you? I would like for you to stand with your arms extended as straight as possible and with your eyes closed. If you could stand, please. Okay, perfect. So the patient is positive for this exam. Okay, perfect. Thank you so much. And I did see upon assessment that your skin is overall looking healthy. Like I mentioned before, there is no ecchymosis, no bruises at this time. So that's amazing. With your skin, I did feel that it was warm to touch, but it was not warm as a fever, so it was within normal limits. Okay, so now I'm going to assess your mental health. Are you sleeping okay?
Yes.
Okay, perfect. Are you having any hyperactivity? Do you feel hyper all the time?
No.
No? Okay, perfect. Do you suffer from anxiety or depression?
No.
Have you thought of killing yourself?
No.
Or are you actively thinking of killing yourself?
No.
Do you hear any voices or hallucinations?
No.
Okay, perfect. No problem with that. So I'm gonna go ahead and wash my hands one more